so much for joining us and being a part of this conversation. My information should be on the slide here, so if anyone does have any questions after the webinar that you think of later, you can certainly reach out to me by phone or email and I'd be happy to answer those. So what are my goals for today? I really hope to dispel some of the myths and misconceptions around cannabis and legalization, talk about the health effects from a balanced approach, both positive and negative, and reconstruct any misleading views of substance use. All of the information that I will share today is evidence-based and comes from lived experience perspectives from the literature. And to set some expectations for today for all of us, the road to legalization has been pretty rocky. There's been lots of changes and confusion. There's really not enough research in a lot of these areas that we will talk about today. So some of our answers to your questions will simply be, we don't have enough information at this point. So hopefully with cannabis being legalized, we will be able to study it more closely and learn more about its effects. Everyone comes into the cannabis conversation with different views and experiences, and not everyone will agree with a public health approach, and that's okay. Our job today is to provide the best available evidence that we have in an honest way so that you can make an informed decision about how you'd like to address potential issues in the work setting. Substance use is always a difficult conversation to have, so we're doing this in a safe space today and encouraging participation because we want to hear your perspectives. So what was the point of legalization? Why in the world would the Canadian government do this? And it's really about making substance use a health issue rather than a criminal issue or a legal issue. And we've learned a lot from other countries that have done this, like Portugal and the Netherlands, and from Colorado in the States, who have done this specifically with cannabis. And it's really about reducing harms and promoting safer use, not a just don't do drugs approach. It's also about protecting vulnerable populations, which include youth, pregnant and breastfeeding women, and people with personal or family history of mental health and addiction issues. It's also about improving safety and awareness around roadways and impaired driving, as well as through regulating the supply. So making it safer for people who do choose to use cannabis and providing access to safer products. And I really wanted to put things into context today. So tobacco and alcohol have been legal for years, and there's more health and social harms that have come from these two substances from a population health perspective than cannabis has ever caused. So while cannabis is a hot topic right now, alcohol and tobacco are still very much public health concerns. And currently there are more people that report using alcohol than cannabis. The normalized culture around alcohol contributes to a lot of these misconceptions and misinformation. So we really do need to work together to prevent this from happening with cannabis and other substances in the future by keeping health issues at the forefront of the conversation. So a bit about cannabis as a drug or a substance. What it is, how it's used, what are the effects? So cannabis has a pretty unique culture around it and many slang terms and jargon. It can be confusing at times for people who are maybe not as familiar, such as workplaces. So it's just important to be aware of some of this language and what it all means so that you can address any issues in an informed manner. Public health uses the term cannabis because that's the scientific term. We try to stay away from the term marijuana because it's actually a racist term that was coined by the US government back during the reefer madness era to discriminate against Mexican immigrants that we're traveling across the US border and potentially bringing cannabis into the States. So we do try and stay away from that term. So how is it used and what is it exactly? It's a psychoactive substance. And what does psychoactive mean? Well, that means that it has effects on the brain and the brain's ability to think and make decisions and perceive things clearly. So what is cannabis? It's a psychoactive substance that comes from the dried flowers and leaves of the cannabis plant, and it can be used in many different ways. So it can be smoked, it can be vaporized through a e-cigarette, a bong or a pipe or a vaporizer. It can be mixed into food or drink and consumed, and it can be heated and inhaled, which would be called dabbing, in the form of an oil, wax, or a form called shatter, which is made from resin or hash. And this method of use in particular is very concerning because oils, waxes, and resins have much higher levels of THC than the traditional dried plant form. Cannabis smoke contains similar levels of tar and chemicals as tobacco smoke and can increase the risk of lung disease such as bronchitis, chronic cough, lung infection. And these risks are exacerbated by deep inhalation and breath holding, which many people do to try and experience a more rapid high. So if someone is choosing to smoke cannabis, it's important to avoid deep inhalation and holding their breath. Vaping is considered a lower risk method to consume cannabis, although we don't know enough about vaping yet. And edibles are also a harm reduction method, but they are not without risk. There's a delayed onset of the psychoactive effects, and that can lead someone to perhaps consume more than anticipated or more than their tolerance level. It's certainly a concern when we're talking about impaired driving. If someone is experiencing delayed onset of effects, they may think that they're okay to get in a vehicle and drive. So there's many different chemical components in cannabis, and some sources are saying now that there's over 100 different kinds. And the types that are most well known and the kinds that we hear the most about are CBD and THC. So CBD, cannabidiol, does not produce a high or intoxication. It's the non-psychoactive component of cannabis. And it's most well known for its medicinal properties, which include treatment of chronic pain, inflammation, and nausea in people with cancer undergoing chemotherapy. We don't know enough about CBD yet, but we're still learning and hopefully we'll learn more. THC, or delta-9 tetrahydrocannabinol, is known as the component that is most responsible for the high or intoxication associated with cannabis. So it's the psychoactive component. And for people that do use cannabis, it's recommended to use lower amounts of THC levels for safer way to use. THC levels are described as a percentage, usually, and cannabis in dried form is anywhere from 10 to 20% THC. And it used to be much lower 20, 30 years ago. It used to be about 3 to 5%. So that's a pretty dramatic increase. And as described before, those concentrated forms can be anywhere from 50 to 90% or even higher, which again is very concerning as THC can cause some of those unwanted negative side effects. And here we have just some of the perceived benefits and side effects that we hear from people with experience using cannabis and from across the literature. It's important to look at both sides, positive and negative, as knowing this will help us understand why someone might choose to use cannabis and potentially what workplaces could do to mitigate some of those concerns. So for example, if someone is using cannabis problematically for stress-related reasons, how can a workplace help facilitate a healthier work environment to perhaps decrease stress or anxiety? The benefits that are evidence-based that we know of at this point include use for chronic pain relief as an antispasmodic, so in conditions like MS, and as a treatment for nausea in people with cancer undergoing chemotherapy. An important thing to note on this slide is that psychosis as a potential side effect is probably the most concerning. Cannabis is related to schizophrenia in persons with personal or family history of mental illness. So it's important to be aware of your own and personal family mental health history to understand whether you are at risk before choosing to use cannabis. People need to be having these conversations with their healthcare practitioners and with their families. And of course, there's a lot of stigma around mental health issues, and so it's a difficult conversation to have. But in terms of cannabis use, this is a huge risk, and psychosis and schizophrenia are likely the greatest harms associated. So there are a great deal of misconceptions about the effects of cannabis. Of most concern is this widely perceived notion that cannabis is not harmful because it comes from a plant or because it's natural and that it's not addictive. And these perceptions are simply not true. Any substance has the risk and the potential to be misused or cause dependence, and cannabis is no different. There are a variety of factors that weigh into whether someone is at risk of harms associated with cannabis use, and these are the factors that contribute the greatest. So length and intensity of use, we know that the more frequent and intense consumption is, and the longer someone uses cannabis for, the more harms they're at risk for. How potent the product is, so again, higher THC. So just to backtrack a little bit, these are the factors that contribute to how someone might be at increased risk of harms. So the length and intensity of use, how potent the product is, so the higher THC concentrations increase risk for harms. Individual factors such as genetics or personal vulnerabilities, so that would be like a past experience of trauma or abuse. Those things can impact whether someone experiences harmful or risky use with substances, and age of initiation. And this is important because people who start using cannabis at a younger age and at a higher frequency are at greater risk of harm, so under the age of 16. And when we talk about substances, we often consider it through this spectrum of use. And this is important because you need to tailor your conversation about substance use, depending on where someone might be along the spectrum. Your conversation with someone who doesn't use at all will be very different than with someone who might be experiencing substance use disorder. It's not about screening them, but it's just about having an appropriate discussion and meeting them where they're at. I won't spend too much time on the medicinal side of things. Public health, although we are a health organization, we don't have much to do with medicinal cannabis. We recommend discussing potential risks with your healthcare practitioner prior to using any form, whether medical or non-medical. Okay. And we're going to move on to looking at cannabis from the workplace perspective.
Thanks, Jordan. Hello, my name is Elise Maritet, and I'm the Principal Consultant for HR Plus by Design. I've been dealing with impairment in the workplace for well over 30 years as an HR professional, and just recently completed a contract with the Public Services Health and Safety Association, where I was part of the team working on cannabis resources for clients. I'd like to thank Michelle and the Public Health Unit for asking me to speak on what the challenges are in the workplace regarding cannabis and offer some practical solutions to you. So why is this a workplace issue? Well, like I said in my introduction, this is not a new issue. People have been coming to work under the influence of alcohol and drugs for years. With the legalization of cannabis, the concerns now are that more people will come to work impaired. So if you haven't had any issues before, you might now if that comes true. Plus, there is legislation that requires you to be prepared, and it's also the right thing to do for your workplace. So specifically, the legislation under the Occupational Health and Safety Act in Section 25(2)A states that employers shall provide workers with information on workplace hazards. So that includes preventing the risk of cannabis impairment or any impairment because they are hazards as well. And you have to also develop a program once you've identified hazards to monitor and prevent substance abuse in this case, or use or abuse. So this is often in the form of a fit for duty program, which includes all impairment possibilities, whether it's from drugs or alcohol, as well as things like fatigue and stress. And it could also be a program specific to substance abuse as related to drugs or alcohol. So what are the workplace challenges? There are many, but these are the common ones that I've come across and what I'll go through in my portion of the presentation today. How can you tell if someone is likely impaired? And then what do you do if you have reasonable suspicion that they are impaired? And another common question is how to accommodate medical cannabis. And then there are other questions and issues around drug testing and safety sensitive positions, which can get really complicated. So let's start with the signs and symptoms of cannabis impairment. It's important to remain as objective as possible when dealing with impairment concerns. The Human Rights Commission states that when an employer observes changes in an employee's attendance, performance, or behavior that may indicate possible substance dependence, it triggers the employer's legal obligation to initiate a discussion with the employee about a need for accommodation of a disability. And this is called the duty to inquire. So if that discussion results in the employer having reasonable grounds to suspect substance dependence because there isn't a disability, then they have the obligation to inquire. So you do have the right to do both of those things. So how can you determine reasonable grounds to even start the conversation? Well, objective evidence is the best way to do this. So these are some signs and symptoms that will help you quantify reasonable grounds. These are taken from the Canadian Council of Occupational Health and Safety White Paper on Workplace Strategies, Risk of Impairment from Cannabis. It's not an exhaustive list, and you can find more by downloading the resource. So for instance, some behaviors might be that people are nervous and excited. They could become insulting. They might seem sleepy or fatigued or confused. They could become quarrelsome. They might have poor memory, and they could be really talkative. Some unusual actions that could be present are sweating. They might be moving slowly, or alternatively, they could be moving quickly. They could be crying, tremors, and they could be in a fighting mood, which is part of the quarrelsome behavior. Their speech might be slurred, it could be thick, could be slow or rambling, it could sound pressured, and their balance might be off. They could be falling and staggering. They might look unsure of their footing, and they might be needing support. So again, keep in mind when you're going through these, it's not up to the employer or the supervisor to diagnose or recognize a disability. They can only observe and address the concerns. It's up to the employee to disclose an addiction or disability. And by capturing what these objective signs and symptoms are, that's one way the supervisor can initiate the conversation. So there are also subjective signs of impairment, and while there could be other reasons for these signs, if they are in combination with the objective signs, then there is a higher likelihood that substance abuse is present. And this should alert supervisors to pay closer attention and possibly have a conversation. So obviously, if you see drug paraphernalia in the workplace, that is an objective sign, but depending on where you find it, it could become subjective. There could be, you might be aware of difficulties at home, you might be aware of legal or financial troubles, you could see an increase in medical disability claims. There could be non-work related visits from strangers that are meeting this employee that you're concerned about. There might be excessive absenteeism or tardiness. They might be having some poor work performance, increase in accidents, difficulties dealing with others. They might try to avoid supervision. There could be changes in physical appearance. So lots of reasons to make your notes and start to have conversations with people. So now you have some objective and possibly subjective evidence and suspect impairment. So this is where many workplaces struggle. What do you do? Well, the first thing you should do is take action to minimize the risk. This is your due diligence defense, and it's the right thing to do to protect the safety of the workers and others. So initiate a discussion with the worker about your concerns and possible solutions. Speak to them in a private area to respect their privacy. You can also offer union representation or allow an employee advocate to be present if there's distrust. State your objective findings based on the signs and symptoms that you've recognized, and just ask them to explain why these things are happening. There could be lots of reasons for them. And the options and support that you offer are going to depend on what their response is. If they self-disclose an addiction, then referring them for medical assessment might be appropriate. And if not, then referring them to your Employee Family Assistance Program or community supports if you don't have an EFAP might be appropriate. If they're in crisis, then summoning immediate assistance, either in the form of 911 or getting them safely to the emergency department, could be required. Whatever you do not permit driving. You should escort them home or have them use a taxi. Be sure that if you're the one having the conversation, that you're empathetic and non-judgmental. Remove any personal biases you may have about substance abuse or addiction. And there should be no stigma involved, just concern for safety and their well-being. And then you may need to take disciplinary action if there's been a breach of your company policy. Even if they confirm substance abuse, they may still have breached a policy like smoking cannabis on company property or another thing. And those need to be taken, action needs to be taken in disciplinary form. And then finally, you must document. You have to do a formal incident report if you're going to have a solid program. Detail the events that prompted the discussion. What were the signs and symptoms? What were the unsafe work practices? What matters did you discuss with the employee? What actions were taken? What were the recommendations? Was there accommodation needed, if any? So documentation is key, not just to record the matter, but also to use again as a due diligence defense if there's ever a human rights complaint or a health and safety investigation. So now let's talk about the complicated topic of drug testing in safety-sensitive positions. So when is it okay to drug test? Well, there's no black and white answer on this. I'll try to keep it simple, but it often gets complicated, just like the slide. Testing has been found to contravene the Human Rights Code if discrimination is for when a substance abuse disability is found. So any company drug testing policies, if you choose to do any, should be reviewed by legal before being put into practice. If you do testing, it has to be based on what is called bona fide occupational requirements, or BFORs. So those are the needs of the positions that are rationally connected to performance, excuse me, are adopted in good faith to fulfill legitimate work purposes, and are considered reasonably necessary to accomplish the work. So if someone cannot do the BFORs of a position, then you must accommodate them unless it poses undue hardship to the workplace. BFORs can be justified more easily if an employee is in what is considered a safety-sensitive position. So that's the tie-in with the drug testing. The workplace can define that based, again, though, on objective and a formal threshold related to safety. And those thresholds have to balance common human rights against the safety requirements. And this is where, again, workplaces have had a lot of challenges in the courts because there's been many court cases focused on these issues that have where the employer has not been allowed to do testing. So again, legal review is important. Drug testing is easier to defend or put in place when there's been an accident in the workplace or a near miss where substance abuse is suspected. And this is called post-testing. Also, if an employee agrees to do drug testing as part of a return to work plan, is recommended. So one of the reasons for the arguments around drug testing is because it does not necessarily measure the current state of the person, as there is a latency effect from use, like Jordan mentioned, to impairment, depending on the mode of use. So cannabis can stay in your system for days or weeks, and levels can mean different things for different people, depending on how often they use. So doing a drug test doesn't necessarily give you the information that you need. So you can see there's no easy answer on when drug testing is acceptable. The best thing to do is build your Fit for Duty program on what you think is fair and reasonable to keep the workplace safe, review it with legal, and then go from there. So reasonable suspicion training is formal training once you've had your program defined for your supervision and management teams. It's a key tool to help them be competent when dealing with suspected impairment, and it also gives them the confidence to approach the subject with employees. So if they suspect impairment, they should document their observations and confirm against a checklist of some sort that there is reasonable suspicion, and then discuss those concerns with the employee and determine steps to take, which may or may not include the drug testing based on what I just discussed. Other actions could be referring to medical or EFAP, taking disciplinary action as well, like we've discussed too. So not only should there be training for the supervisors and managers, but it's also prudent to educate the entire workforce to some degree on what your company policy and program is, not just what is expected of them as an employee, but also as a coworker. Because the more people that are aware of what to look for and report, the more help you're going to have to reduce the risk of harm for all employees. It just doesn't have to be as integrated or complicated as the reasonable suspicion training. So some resources I'd like to leave you with. This one is a good add-on to your communication and training program for all employees. It explains what the therapeutic and recreational use of cannabis means for your workplace. And it also outlines the symptoms of impairment, elements of an impairment policy, roles, etc. And it's a good thing to leave posted on a safety bulletin board or in the lunchroom after the training. There is a minimal fee for these, but well worth the cost. But it is not sufficient for your supervisor manager reasonable suspicion training. Your HR department should be able to develop a course and train your team as needed, or you can seek an external trainer to do this. And lastly, I did refer to this resource previously. This is the white paper, and it has sample policies and reporting tools for you to customize for your workplace. So feel free to contact me if you have any questions. And Michelle has my contact information. It's also on the presentation. And thank you for listening.
Hi there, this is Nick, the Tobacco Enforcement Officer from the Chatham County Public Health Unit. I'm going to sort of walk you through the legislation that governs cannabis in the workplace. So let's get started. The Smoke-Free Ontario Act is the main act that we're sort of talking about here. It governs the smoking and holding of lit tobacco and cannabis products in the workplace. Excuse me. Under the Smoke-Free Ontario Act, it is illegal to smoke or vape cannabis or related product in an enclosed workplace, which also includes workplace vehicles. I found in my experience that most people are fine with an office or a manufacturing sort of space being smoke-free, but that usually doesn't extend to workplace vehicles for whatever reason. Anyway, the method of smoking, vaping, or inhaling cannabis smoke doesn't matter. Whether the person is holding cannabis, like a joint or marijuana cigarette, utilizing a vaporizer or electronic cigarette, it remains illegal in an enclosed workplace. In addition to the provincial law, there is also the local bylaw, Chatham-Kent, number 137/2014, the Chatham-Kent Smoke-Free Bylaw. It has a very broad definition of smoking, but in general, as far as workplaces are involved, the Smoke-Free Ontario Act is the one that is going to come into play most often. For the purposes of a workplace, there's no differentiation between medical use and recreational use. So even if someone has medical clearance, let's say from a doctor or something like that, to use cannabis as part of treatment, that doesn't mean that they can light up in their cubicle or at their workspace. So if someone wants to use their medical marijuana at work, they have to do so outdoors in a place that wouldn't otherwise be prohibited. So like, let's say, a workplace shelter. One thing to sort of keep note of if you are adjacent or on the municipal property, the Chatham-Kent smoke-free bylaw would come into effect there, so it would still be illegal. So if you have any questions about sort of your grounds and where would be legal or illegal for someone to use either tobacco products or cannabis products, please feel free to give me a call at the health unit, and I'd be happy to take a look at your property and guide you sort of in the right place. As for edible products, those aren't legally allowed to be sold yet. And since they aren't, smoked or inhaled, obviously, they don't fall under the auspices of the SFOA or the local bylaw. For now, it would probably be best just to include edible cannabis products, leaving otherwise homemade or government-sourced in your substance use policy, and treat it like you would alcohol use or drug use in the workplace. Here at the health unit, we recommend to all workplaces to enact some type of workplace policy that sets out your wishes as the employer regarding tobacco or cannabis use or lack thereof for your employees. Policies can't contravene the law. You can't allow smoking or cannabis use in a place where it's prohibited by law. However, workplace policies can exceed the law. For example, most workplaces, unless they're like a hospital or a government sort of building, most workplaces don't have a 9-meter setback from any entrance or exit. Often people think that any business has a 9-meter setback from their doors. But you are able to enact that yourself as the employer. You can also designate smoke-free areas around your property or make your entire property smoke-free. And the Chatham-Kent Public Health Unit offers assistance to workplaces that want to create a policy. We provide a workplace smoking package that has sample policies that workplaces or joint health and safety committees can copy verbatim. And it sort of lays out a few different options, such as smoke-free entrances or making your entire property smoke-free. As for the signage that's required, pictured on the slide, you'll see on the left there's the old no smoking sign, which is still valid, and then there's the new sign that sort of governs electronic cigarettes or vaporizers, that sort of thing. Below there's the combined sign. So what I'm looking for from workplaces is to have either the pair above or the combined sign. If you don't have those signs yet, don't worry about it. Rome didn't get all of its no smoking signage in a day. A lot of that signage is very new. So if you need some, please contact me at the health unit, and I'd be happy to send some out, or alternatively, you can send someone to the health unit to pick up some signage. We made an order from the ministry recently, so we do have some that we're able to give out to workplaces. For your reference, when you're sort of estimating how many signs you might need, signs are required at every entrance, exit of a building, washroom that's accessible to anyone in the workplace, and also any workplace vehicle. And it also doesn't hurt in, let's say, like a break room, elevators, stairwells, or other common room that people might use where they might not, where the message, being delivered by a sign would be helpful. Workplaces often ask me if they can make their own signage. Yes, you can. If you're, the signage that you make is reflects your policy more than just the law, then as for enforcement goes, I can only enforce what is there present in its existing legislation. But absolutely, you're free to make your own signs. But the signage that I'm looking for that is legally required is there, and it's available for free. So if you just sort of lean on the government to get your signage, please feel free to do so. And thank you very much.
Thank you very much, Jordan, Elise, and Nick. And in the interest of time, we did cut Jordan off earlier. We each had 15-minute slots, but I can see that we do have a little bit of time left. So Jordan has agreed to finish up with her presentation. So if you'll bear with us, I will actually just be going back in the slides. Sorry. Here. Go ahead, Jordan.
Okay. I can never seem to stick to a short time frame, so Nick saved my butt and got finished really fast there. We just wanted to reiterate that when it comes to substance use, like Elise, of factors. So for example, there's always things going on as a society, and relationships and interpersonal things, past history of trauma or abuse, other social determinants of health like housing and income that could perhaps lead someone towards or even protect someone from using substances problematically. So this statement really just recognizes that people use substances for various different reasons, usually for anticipated benefits, and that problematic use is often a symptom of underlying psychological or health issues or inequities. So some key takeaways. First and foremost, the best way to avoid any risk and protect health is to avoid using cannabis. Young people are most likely to experience harm from cannabis because the brain is still developing until age 25. So the earlier cannabis use starts, usually the greater the risks. It's important to try and delay cannabis use until after the age of 25. Impairing effects of cannabis depend on many different things. For one, how it was used. So was it smoked, vaped, or ingested? Was it a concentration that was used? How much of the product was to cannabis differently? Situational factors, so where is it being used? Were there other substances used? What tasks is the person trying to perform? Did they eat something prior to use? And the effects of cannabis can last for at least 6 hours or longer after use. Again, edibles can last much longer than that and have that delayed onset. Cannabis can last in the system up to 24 hours and can stay in the system for 30 days when it comes to drug testing and things like that. Like Elise said, it's really difficult to be able to tell impairment versus whether it's present in the system. And this is just speaking to, again, the risks associated with impaired driving. After alcohol, cannabis is the drug most often associated with car accidents. Cannabis can affect things like concentration, coordination, reaction time. So using cannabis and driving increases the risk for an accident. Using cannabis at the same time as other substances, and in particular other depressants, so like alcohol or opioids, actually further lowers your ability to concentrate and react quickly. And again, smoking cannabis can cause harms to the lungs and respiratory tract. So if someone chooses to use cannabis, there are safer ways to do so, such as vaping, ingesting, or using a topical like a cream. And again, all substances have the potential to be misused and cause dependence. Cannabis is no different. So if you choose to use, try and avoid using daily, include some break days throughout the week, use lower risk products with low THC levels, and try to start low and go slow and be mindful of how cannabis affects you.
Thank you, Jordan. Thank you to everyone who participated today. As I mentioned earlier, this webinar will be available in a few weeks. I will be sending out the link to it, as well as you'll be getting the slides. And on that, you do have everyone's contact information. I see that there are no questions, but if you do think of questions afterwards, please send the questions to me and I will certainly direct them to the correct person. Thank you very, very much for participating and have a great day.